All right, let's get into some of the questions. These are patterns of questions that we've seen here at Apex Benefits that have come through over the last several days. So they're real. And I think Andy will also have some offshoot questions as we go through these. So, Brooke, would you take the first one?
Sure. So due to a reduction in hours scheduled to be worked, it's likely employees won't have compensation to cover the cost of benefit elections. Can benefits be continued by collecting past due premium payments from employees when schedules return to normal?
Okay, so again, I think we all know the first issue is ensure that what the company is doing here is consistent with the terms of the employee benefits plan documents, including the insurance policies. For example, the healthcare plan terms should define when coverage terminates and then subsequently when a COBRA qualifying event occurs. If the employer wants to be more generous than the plan terms, again, we covered that you can do that, but it needs to consider whether or not it's such a change that the plan document needs to be amended. And again, and that you have the insurer's consent. And again, your insurance consultant should be helping you with that. And that's, again, in the fully insured or self-funded world. If a decision is made to be more generous in the plan terms and the insurer consent is not contained, the employer is at risk of picking up the responsibility for any large claims that might come. If severance is to be paid in the form of a simple lump sum, probably won't catch any ERISA issues there. But if the severance package gets more complicated, like it's going to be paid out over a longer period of time, or the company is going to, as part of the severance package, help subsidize COBRA, talk with your attorney, talk with your insurance consultant, because ERISA may be implicated there depending on the situation. And then, of course, remember your Affordable Care Act requirements. What provisions will apply when and if the employee is rehired? Is this consistent with the company's intent, or might plan amendments be required there? ACA generally requires certain rehired employees to be treated as continuing employees if their break in service, for example, is short enough.
So we kind of touched on this, but what needs to be considered from a health plan and Affordable Care Act perspective regarding furloughs? So I think it goes back to what we've discussed is check your plan document. If you need to make an amendment, make an amendment. Ensure that your practices are aligning with what's in the document, and review your measurement periods. So review those measurement periods to ensure that you're not inadvertently throwing an employee into an ineligible situation by furloughing them this year, and then they're ineligible for the plan next year. Because you can just go and credit those hours back to the employee to get them onto the plan in the following year, 2021. Okay, so we have decided that we need to terminate employees due to our company's financial situation, but we hope we can rehire them. What employee benefits issues do we need to consider?
So we kind of covered this in the last question too, or at least I did. But again, plan documents, consider whether a COBRA qualifying event has occurred. Remember that severance packages may involve an ERISA situation, so be careful there. And then know that your Affordable Care Act is still out there, alive and well, and really hasn't changed that much in terms of the COVID-19 situation. So you'll have to make sure you're compliant with ACA at all times.
Right. And as I'm a 401k just complete dork, I would also encourage you to remember that when that employee returns to service, if shortly rehired, that's going to put them back to their same tenure requirements that they had prior to leaving. So what happens? I'm not working at this time due to COVID-19. Can I decrease my dependent care assistance program election amount, as I do not need daycare services right now?
Yeah, this was another. They're all actual questions or patterns of questions, but this one seemed pretty specific, and we're starting to get questions like these, Brooke?
Right. So first, can I decrease my election amount? And the answer is yes. So we know in a normal situation, if you change daycare providers that change costs, you can adjust your dependent care situation. If you have a reduction in hours, if you have an FML or a change in employment status, or a substantial change in the benefit, the cost of your plans, can you decrease that amount? And the answer is yes. So if your daycare is closed, that would trigger a change in cost, right? I would just encourage everyone, just like you do with your HSA receipts, is just maintain the documentation if it is ever called into question. So maintain that documentation for your appropriate amount of time.
Got it. Andy, anything to add there?
Not to that question there. I guess my concern in, some of the smaller clients that we deal with is more of, what if I just can't pay? I know there's a 30-day grace period, but is there any kind of provision or anything along those lines if an employer just simply says, I don't have the money to make these benefit payments?
Well, there is, and we talked about this in previous videos, there is the Paycheck Protection Plan that came with the CARES Act and that the SBA is starting to administer. And by the way, I've heard this is April 1st, so I hope it's not a cruel April Fool's joke, but I heard by the 3rd, the first SBA loans should be going out. And I know they're starting to receive applications as of today as well. So a flurry of activity around all that. Now, with your Paycheck Protection Plan loan, which again can be forgiven if you maintain employee headcount, that money can help pay your employee benefits. So that's a usable or an okayed use for that money. Now, for the economic injury loans that are separate but complementary to the PPP, that money cannot necessarily be used for payroll costs, which employee benefits would be, but they can be used for capital and other operational capital requirements. So, point being, there is some flexibility there, Andy, to continue if you qualify for a PPP loan. Again, that can be forgiven, and that means that it's pretty simple: that you were in business February 15th, that you had employees, that you can prove that based on previous years' payroll costs or some alternative ways. You should get the loan. It's not even based on if you can pay it back. It's those two requirements should get you into that queue. Do get into that queue because I think the PPP is limited about $349 billion, which I know is a tremendous amount of money, but they're expecting it to go fast. So get with your SBA lender on getting that process going if you haven't already. One other thing I'd add to the first question that we had back, if it's likely that employees won't have compensation to cover the cost of the benefit elections, can benefits be continued by collecting past due premium amounts? I forgot the moose on the table there a little bit, but it's the catch-up plan. They can pay when they get back. They can also pay as they go if they can. Again, still watch the ACA to make sure you're ring compliant with it. But the catch-up plans, as we mentioned in the checklist portion of this presentation, can be made over time when the employee comes back to work. And I think that's about it. Brooke, do you have anything else?
I would just, with that, just ensure that you check with your counsel so they can check with those state and local laws for those wage payment laws that can be a bit of a bugaboo. So do you need their permission in writing? What does that look like? And that can vary based on state. So Make sure you double check that.
Well, I'd like to thank you both for joining. We here at Apex Benefits and Axiom are here to serve. Let us know if we can help, and thank you for listening.
Thank you.